Hello, I'm John Kanelopoulos from Athens, Greece, and New York City, New York, clinical professor of ophthalmology at NYU Medical Center, New York City. It is my pleasure to present to you today the very helpful application of OCT-guided femtosecond laser-assisted astigmatic keratotomy. As a cornea surgeon over 20 years, I found astigmatic keratotomy a very helpful tool in giving visual rehabilitation to extremely difficult cases such as very high post-keratoplasty astigmatism, and at older times reducing the astigmatism with extracapsular cataract extraction, which was by the rule against the rule astigmatism. I'll show you a quick example of the traditional technique that I had trained over 20 years ago in using a diamond blade and a cornea marker, and how this technique has evolved through the years with the advent of the LenSx femtosecond laser and its OCT guided ability to perform very eloquent, precise, and adjustable astigmatic keratotomies. We'll see the LenSx laser engage, correct for cyclorotation in lieu of a 6 o'clock mark that we perform on the slit lamp, and then customize basically in any way possible the astigmatic incisions as far as their optical zone from the optical center, their arc, and their depth, which is the most fascinating for a cornea surgeon in regard to the live OCT image taken at the time of the surgery, which gives you the ultimate correction. Then last, these incisions can be performed partially by the femtosecond laser, leaving just a 50 micron surface that's untouched, and this can make them then adjustable at the slit lamp. So the ability to be able to adjust this without having to go into surgery 1 or 2 times more. You can do the adjustment on the slit lamp. I hope you find this presentation helpful, and I thank you very much for your attention. So here's the old technique. We have a cornea marker with 2 90-degree arcs, a stabilizer, Thornton stabilizer of the globe, and then a diamond blade that has been set to 630 microns, which is 100% of the cornea thickness. You see I embed the blade in the stroma, wait till it cuts through, and then cut through the arced incisions. Same thing with the inferior incision here. This requires extreme stability. The incision is short, I'm lengthening it here, and this is the end result. And now, as you can see, this is much more eloquent. We have fixated the globe. We're trying to rotate now to the 6 o'clock spot you saw me pointing at the top of your screen. We're adjusting now the astigmatic keratotomies. These will be 90 degrees, AKs at 7 millimeter, and 85% depth according to the OCT. And now I'm cyclorotating the globe. In cyclorotating, I'm overshooting the 6 o'clock spot, as you can see superiorly in the LenSx laser screen, and now I'm right on my 6 o'clock mark. I'm obtaining OCT, and the machine itself drives the depth of the incision, and this I will adjust first in the top right screen. I will click on the top green dot and bring this right under the epithelium, and then the bottom green dot and bring it under the endothelial surface, and then do the same thing with the other incision. Step on the pedal after all this is approved, and we have the 2 perfect accurate incisions at the correct orientation as defined in the slit lamp pre-op. Getting off the LenSx now, you can see here another patient example, a lot against the rule of astigmatism. This is another post-keratoplasty patient, and we will again adjust for cyclorotation, rotate the LenSx platform on the 6 o'clock mark that we had placed in the slit lamp, which is now present superiorly. You can see this fine adjustment ensures correct placement. Now I'm adjusting to the center of the visual axis, which in this patient is the pupil, and then obtaining OCT, adjusting the depth of the incision on OCT as we saw previously, and then perform the astigmatic keratotomies, which in this situation are oblique on our screen, but as we saw in the topographer, they're almost against the rule of astigmatism. And after this procedure is adjusted, we saw first the right AK, and then the left. We will take this patient on OCT. You can see this is before we open this incision. Completing the AKs on the slit lamp with a Sinskey hook. This can be adjustable with a Sinskey, and this is after you can see the wound disengaged, and this now paints with fluorescein. So how effective is our treatment? Back on the slit lamp, we're determining here the exact position of their arcs, 153 to 54 degrees on the slit lamp, and here before on the left, after on the middle, and difference on the right, the exact correction we needed. Brilliant technology, and I thank you very much for your attention.